Hi, I'm Christine. I've been an advanced lung cancer survivor for 8.5 years. Several days ago, I posted episode 20, How Do I Beat Lung Cancer for 8.5 years. I didn't expect such an overwhelming response, and some Canadian cancer patients asked me to share what we have done to the provincial and the territory government to pay for the drug. I discussed the same issue in the second half of my talk, so I posted here today. Know that since the development of a targeted therapy is so rapid, some data may not be the most current.
Now, I'm going to tell you the second story. That's the challenges I've faced. Actually, a lot of Canadian patients will face the same challenge. The first challenge is the enough biomarker testing or the proper biomarker testing. The second one is availability of a targeted therapy. The biomarker testing decides the direction of the treatment. In Canada, lung cancer patients only test 3 biomarkers, but in states, there are 9 biomarkers that have 9 biomarkers for lung cancer that have FDA approved targeted therapy. Besides, there are many clinical trials available for the Canadians and Americans. So this biomarker, targeted therapy and clinical trials are biomarker specific. If you have to get your biomarkers in order to get the right targeted therapy drug, or you go down the right clinical trials. Only to do the partial biomarker testing is not acceptable. Now, the second challenge we have is the availability of a targeted therapy. In Canada, it's up to the provincial government or the territory government to pay for our drugs. The challenge is that the provincial government sometimes delay or even they don't pay for the biomarker, for the targeted therapy. For example, 1 year after the targeted therapy for ROS1 lung cancer was approved in Canada, only 2 provincial governments agreed to pay for this drug. Meanwhile, I have a friend who has a ROS1 positive lung cancer in Alberta, has to do the fundraise to cover her the medicine cost, which is for us is about $8,000 per month. This is almost not impossible. Now, so what we do here is with the help of Lung Cancer Canada, I organized 15 ROS1 lung cancer patients. We wrote letters, asked the provincial government to pay for the ROS1 targeted therapy. After several months, all the provincial government agreed to pay except the Ontario government. So what we did here is we asked all the Ontario lung cancer patients to ask to talk to the MPPs or to arrange a meeting of MPPs and to talk about this ROS1 targeted therapy. And now finally, the Ontario government also agreed to come to the board to pay for this therapy. Now, my take-home point here is there are 2. One is the biomarker testing is so important, and for those cancer patients, not only the lung cancer patients, must not have the biomarker testing done, but also have the enough biomarker testing there. The second point is that the patient and the caregivers have a voice, have a big voice actually, and only working with the researchers and the doctors, and especially working with the provincial governments, we can turn the cancer into the chronic disease, and maybe eventually we will conquer it. Thank you.
Okay, today we stop here. I'm Christine. Till next time, see you then.